Hi, I'm Phoebe. I'll be your nurse today.
Hi, Phoebe.
Hi. Can you verify your name and date of birth?
Annie, and my date of birth is January 1st, 1997.
Okay. All right, good. Everything matches. We're going to start the head-to-toe assessment with a neurological assessment. Do you know where you are right now?
Yes, I'm in the hospital.
Okay. Do you know why you're here?
No.
Some pain you came in with?
Yeah, some pain.
Okay. All right. Okay. So, inspection, her skin color is okay, no sign of cyanosis or anything, no paleness. Okay, I'm going to start by looking at her scalp for any lesions, bumps. Looks good. Next, do you want to sit like right here?
Like my legs are
Yeah.
here?
So I'm not like reaching for you. Okay, we're going to palpate her scalp. No bumps, no critters. Okay, good. Okay, we're gonna look at your ears. Any lesions? Nope. Just get this thing. Look inside. Okay. No excessive earwax. Okay. Good. Okay, I'm gonna look at your eyes. Start with your eyebrows, symmetrical. Their hair is full. Okay, eyelashes. Good. Look at your pupils, your eyes. Okay. They're the same size and round, and they're reactive to light. Good accommodation. Okay, look at your nose, your mucosa. Okay, good. Okay, now I'm going to look at your lips. Good, they're moist. You can open your mouth. Look at your tonsils. You have tonsils, right? Okay. Okay, good. Can you go, like, lift your tongue up so I can look under your tongue? Okay. Okay, so no signs of inflammation in your tonsils, and your tongue looks good. No lesions or inflammation. Okay, now I'm going to move on to the cardiovascular assessment. I just need my stethoscope. Okay, so look, jugular vein distension, no. Okay, good. Let's look at your trachea, straight and in line. Good. Okay, I'm going to pulsate your carotid artery. Okay, good. Nice and strong. I'll do your radial pulses. Good. +2. You're strong. Do your capillary refill. =2. Okay. Now I'm going to auscultate to listen for any graze on your carotid artery first. Okay. Now we'll start on the second intercostal space on the right. Second on the left. Mark. Herbs. Okay, good. No abnormal sounds, no murmurs, which is good. Now we'll do a respiratory assessment. Are you breathing okay right now?
Mm-hmm.
Yeah? Okay. So we'll auscultate your lungs. Listen for any wheezes or crackles. So normally, with a patient, I would go usually under the gown and wouldn't auscultate over any clothing. Okay, now for posterior. Sorry. Okay.
Should I do deep breaths or breathe normally? Should I do deep breaths?
Yeah. So that sounded good. The lungs were clear, equal bilaterally. Okay, now I'm going to do an abdominal assessment. So if I could just have you lay on your back. Oh, no, so yeah. Okay. Alrighty. And so for your pain now, are you in any pain?
Yeah.
Okay, and how would you rate it on a 1 to 10 scale?
Like a 6.
A 6, okay. Alrighty, so I'll start by just feeling and looking if there's any distension. So there's no distension, which is good. So first we're going to auscultate in the 4 quadrants and listen for vowel sounds. Okay, so they sound good, pretty active, and if they were absent or I couldn't really hear them, I would do them for about 5 minutes until I did hear. Okay, good. So yeah, they sounded active, which is good. Yeah, there's no distension, it's flat, which is good. And next we're going to do percussion. So I'll do it gently. Any tenderness or any pain?
No.
No. So if it was really painful, it would be important to do it lightly and just be careful and let someone know, because that's concerning and not normal. Next, we're going to palpate. So I'm going to use my 3 fingers and go gently and in a circular motion. Does that hurt at all? No? Okay. Okay, that feels normal. Okay, and next I'm gonna go to your lower extremities. If I can just make this. The color still looks okay. Do your pedal pulses. Okay, +2, strong color. Do you feel any sensation or any numbness? Feel that now? Okay, careful your refill. Good. I'm gonna have you push against me. Good. And push up. Okay, good. So range of motion is good, and the strength and sensation are strong and equal. Okay, so I will put your call bell right here. So call if you need anything, and I'll come and check on your pain in a little bit, and we'll give you something if you're still in pain.
Okay, thank you.
You're welcome. Hi there, my name is Phoebe. I'll be your nurse today.
Hi,
Can you verify your name and date of birth for me?
Kira Tully, 51892.
Okay, and do you know why you're here today?
Just a checkup.
Checkup? Okay. So we're going to start doing a hair, ears, eyes, nose, and throat assessment. So I'm going to start with your head, and I'm going to start with inspection overall. Looks like you're having an okay time breathing. Your skin looks okay. Let's start with your head. Inspect it. Your hair is full and shiny. I'll palpate your scalp and feel for it's like a massage. And feel for any lesions, any critters. And if I did see things moving in your hair, I would put gloves on. Okay, good. Okay. Next, we will look at your ears, your auricle for any lesions, your tragus. If I push on that, does it hurt at all?
No.
If I pull up on your auricle,
No.
does it hurt at all? No. Okay. Look inside. Okay. No swelling, redness, and no excessive earwax. No lesions on this side. Does this hurt?
No.
If I pull up on
No.
it, does it hurt? Inside. Okay, looks good again. Okay, now I will look at your eyes. I'll start with the symmetry. They're both symmetrical. Your eyebrows, the hair are intact and full on both sides. Oops.
It's him.
Okay. Check your. Okay, your pupils are both the same size. They react to the light both bilaterally. Your eyelashes are intact. Your conjunctiva look good, not too pale. Your sclera, both look an okay color. Your cornea, okay. Okay, we'll look at your nose. Okay, your mucosa, pink, no signs of deviation. Look at your lips. They look moist, not too dry. Okay, now we're gonna do your throat. So if you can go Okay, do you have tonsils? No, you got them. Okay. Tongue looks okay. Teeth. Okay, good. Okay, so now I'm gonna look at your trachea. It's nice and intact. If you can move up, straight and aligned. Next, I'll do your palpate. Okay. And I would auscultate if it did seem enlarged. Can you swallow for me? Okay. You can feel your lymph nodes move equally. Swallow again. Okay. Good. Now we're going to move on to your lymph nodes. Actually, before that, I'm going to palpate your sinuses. So, to your frontal, is there any tenderness at all?
No.
Maxillary?
No.
No? Okay. You feel your lymph nodes. They're not swollen at all. Okay. So, I'll start with pre-auricular. Okay. Post-auricular. Occipital, no signs of any nodules. Okay, tonsillar, and I'm using the 3 fingers gently. Okay, after tonsillar, I do subclavicular. Okay, good. Okay, and so next I do the anterior. Anterior and posterior chain. Okay. The supraclavicular. And so if we felt any nodules or anything, they could be cancerous, and we would want to let someone know about that. Okay. I think that's the end of that assessment. Do you want me to position your bed at all, or you want to lay down?
No, I'm okay.
You're okay?
Yes.
Okay.
Thank you.
You're welcome. Hi there, my name is Phoebe. I'll be your nurse today. Could you verify your name and date of birth?
Charlie Carnes, 3905.
Okay, great. So you came in last night with some trouble breathing? Yeah? Okay, we're going to do a respiratory exam on you. So we're going to start by inspection. Look at his overall appearance, breathing. Looks like he's working hard to breathe in tripod position, using accessory muscles to breathe. Respiratory rate is increased. Let's check and see if there's any clubbing at all. No, that looks good. Okay, we're gonna check for barrel chest. So we're going to look at the anterior and posterior region. The ratio is equal, so 2 to 1. We're going to palpate next. We're going to look at the trachea. Should be straight and midline. Okay, I'll have you stand up now. Are you dizzy at all? No? Okay. Alright, so we're going to check for the chest expansion. Just breathe in, and when he breathes in, my hand should move open 1 inch. Okay, breathe in again. Okay, so the symmetry is good, symmetrical chest expansion. Next, we are going to do tactile fermentin. So could you say 99?
Yeah, 99, 99, 99, 99.
Okay, good vibrations. Let's do the interior now.
99, 99, 99.
Let's try that one more time. Do you need a breath?
Yeah.
Okay.
99, 99, 99.
Okay, good. Alright, so those were nice vibrations that I could feel. There was no signs of consolidation at all, which is good. I think that the vibration would be decreased if there was fluid in the lungs, but no signs of consolidation, which is good. Next, we're going to do a percussion. Okay, percussion test. So I'm going to take my middle finger. Okay. Normal sounds that you would expect. And if there was, since he is having trouble breathing and there's some fluid in there, there's sounds of resonance. Okay, next we're going to auscultate and listen to your lungs. So when you feel the stethoscope, if you could just breathe in, and just let me know if you are having a hard time breathing at all or get dizzy, okay? So we're going to use the diaphragm. And we're going to do 6 sides, both anteriorly and posteriorly. Okay, good. Now I'm going to have you stand up. Did this show? Oh, I'm going to have you stand up so we can see. Turn around. So we'll go right here, and it's important that you don't go over the scapula. Breathe in. Okay, good. So I didn't hear any crackling or anything like that. So that's good. Do you want to lay back down? Are you comfortable like that? Okay, I'll leave your call bell right here and just call us if you need anything. Okay. Okay. Hi there. My name's Phoebe. I'll be your nurse today.
Hi, nice to meet you.
Nice to meet you too. So we're going to do a cardiovascular assessment today. Can I have your name and date of birth?
Anne Goodwin, January 1st, 1997.
Okay, thank you. And do you know where you are right now?
Yeah, I'm in the hospital.
Hospital. Okay. Do you know the date?
It's March 26, 2020.
Okay, so our client seems very alert and oriented, and she's able to answer the questions that I'm asking. She doesn't seem really confused. So to begin Winston, shh. To begin the assessment, we are going to start with inspection. So I'm going to look at our client and look for any discoloration, check if she's in distress and her breathing. So it looks like you're pretty calm and collected, not in any pain.
No, not anymore.
Okay, and you're breathing okay?
Yes.
Alrighty. So we're going to start the assessment also doing jugular vein distension. So this needs to be done at a 45-degree angle. So if you can cut this a little. Okay. Turn. We'll look at the carotid arteries. That's good as well. Okay, now we're going to pulsate the carotid arteries. Okay, normal, steady, even rate. Winston. Okay, so now we're going to oscillate the carotid arteries, and we're going to listen for any worries. And it's important that we do them both separately and not at the same time. It's on my screen. And we're going to do this using the bell of the stethoscope. Alright, so if you can just breathe in and then hold. Okay, good. Let it out. Breathe in. Okay, let it out. Okay, good. So that sounded good. A nice, steady, even, regular rate. Now we're going to oscillate and listen for heart sounds. Okay, so we're going to do this by listening to the aortic, the pulmonic, Erb's point, tricuspid, and mitral. So we'll start with the aortic, which is the left, and it's the second intercostal space. So we're going to start using the bell of the stethoscope for the first round. And then now we are going to do the left, the pulmonic, which is the second intercostal space on the left. Okay, Erb's point, the third intercostal space on the left. Okay, tricuspid, which is also on the left, and it's the fourth intercostal space. In mitral, which is the fifth intercostal space on the left. 1, 2, 5, and it's at the mid-clavicular line. Okay, sounds good. Now we're going to repeat the same thing using the diaphragm of the stethoscope. So aortic on the right, second intercostal space. Pulmonic on the left second intercostal space. Erb's, third. Pulmonic. Tricuspid. And then the fifth, which is the mitral. Okay. So now we're going to pulsate the mitral area to listen for the point of maximum impulse. Okay. And if the heart was enlarged, you would hear it more further down. Okay, that sounds good. So sound 1 and sound 2 seemed normal. There were no murmurs, gallops, or rubs. So now we're going to look at her extremities of her arm for any discoloration. We're going to do capillary refill. So less than 2 seconds, that's great. Okay, and now we're going to pulsate the radial arteries simultaneously and compare them. See. Okay, so +2, so that's great. Then we're now going to look at the lower extremities, look for any discoloration. No. Screen's going dark. Any discoloration? No. Circulation looks pretty good. You can do capillary refill on the toes as well. Still less than 2 seconds. So that's good. Okay, so we're going to do the palpate the dorsalis pedis. +2. Posterior tibial. +2. Okay, and did you feel that?
Any pain?
Any pain or uncomfort?
No,
No.
feels good.
Okay, so circulation seems good. Alrighty. Well, your exam went well.
Oh, good.
I think you're good. Alright.
Thank you so much.
You're welcome.